And right now here on CBSN New York, Mayor Bill de Blasio about to take the podium at Kings County Hospital in East Flatbush, Brooklyn, where he's expected to sign an executive order requiring city agencies to provide New Yorkers with information about affordable health care options. Let's listen in to the mayor, who will take the podium shortly.
Contacted by a rep. I was assigned to a clinic near me. I went in, was given I sat down with, I'm actually recovering from a cold, so I'm not all here. So that's why health insurance is so very important. I am going to get better now because for the first time in 10 years, I finally have health insurance.
Amen.
Thanks to everything our mayor has done. I am so thankful. I qualified for a Metro Plus health plan, which covers me not only, I know, thank you, big thank you to them. Yes. No, I am a little mad at myself that I didn't do it sooner, but I'm glad I sent that text. I was assigned a primary care provider. I've already met with them. I'm actually going back for my follow-up to my physical. This is the first physical I've had in 10 years. I did get help throughout the years, though, thank goodness, to wonderful organizations like Planned Parenthood. They were there. They were really my only health insurance for the past 10 years. And they mean so much to me in my whole life, and so many women in this city, for everything from HPV screenings to birth control to pap smears, any type of annual exam. It's so important for preventative care, because if you catch certain things too late, it's, you know, a mess. So besides them, and I'm very thankful, I just realized one day that I needed more so primary care. I need somewhere to go when I get a cough, which happens way too often, but a cough, an ear infection, and everything. And so it was kismet when I saw that ad for Get Covered, and I finally sent that text. It literally takes 2 seconds to send a text, and was signed up right away. The whole process from me sending that text to being in a doctor's office, getting all my blood work done, was less than 3 weeks. So I can't express to people enough that it's so important to reach out. Everything our mayor is doing to get more of New York City covered is so very important, and I don't think people understand how easy it is, but I will continue to tell everybody I know how easy it is. And yes, with that, it is my great honor to introduce our mayor, Bill de Blasio.
Thank you. Thank you so much, Shaylin. And how many years since you had insurance?
10.
10 years without health insurance. Shaylin, really thank you so much for telling your story and for reminding all New Yorkers that under this new plan, it is easy to sign up for health care coverage. Shaylin is living proof of it, and it's so important. And Shaylin, your story is going to reach a lot of people and going to make a difference. Let's give her a round of applause. Let's thank her. Every New Yorker in the sound of my voice who does not have health insurance should follow Shaylin's example and reach out to Get Covered NYC, because it's going to make a difference in your life and your family's life. I want to take a moment. First of all, I just think the world of the folks who work for Get Covered NYC. They make such a difference in people's lives. They have these very sporty polo shirts, too. Let's thank everyone at Get Covered NYC for all the good work they do. And then I want to say it is a joy to be in a very special borough, the most populous borough, the borough of the birth of my children, and to be with all the folks who do such extraordinary work, all the doctors, nurses, the medical staff, all the staff of Kings County. You guys are lifesavers and difference makers. Everyone give your neighbor a round of applause. Thank you for all you do. Now, I want to take a survey of the room and see what you think. Because here's the reality that has pervaded for years and years and years in this city and this country, where people have to ration their health care. The decision is, do I pay the rent? Do I get health care? Do I get food? Do I get health care? Do I get education? Do I get health care? That kind of rationing has happened for a long, long time. Do we think in the United States of America people should have to ration their health care?
No.
Do we think that's right?
No.
Let me ask you this. Here's a reality that has been common for a long, long time. Probably not for hundreds of thousands of New Yorkers, the place they go for health care is the emergency room. When they have a problem, they don't have a primary care doctor. They don't have the relationships they need to get the help they need, just like Shaylin talked about. Do we think the emergency room should be people's primary care doctor? No. Is that just plain crazy?
Yes.
See, I'm proving that they could do yes and no. And we also know that it is too common that people's lives are upended by a medical bill they can't pay. Literally, their lives paralyzed because they can't handle the cost of health care. Should we ever allow people's lives to be upended because they can't pay a medical bill?
No.
Say it louder.
No.
There you go. Now I believe you. We say right here, health care is a right. Health care is a right. It has been treated as a privilege for generations. It never was meant to be a privilege. It was meant to be a right. Here in New York City, we are making it a right for everyone. Everyone gets health care here. I want to thank so many members of my administration who have worked very hard in this initiative, and the work has just begun, as we're about to describe, because we're going to get the entire city government, all the agencies that serve the people in New York City, to be a part of this effort toward universal health care. We're going to get every single element of our government involved. And I want to thank some of the key people who will be leading the charge. You're going to hear from our deputy mayor in a moment, but I want to thank some of the other key leaders who are here. Of course, Dr. Auxiris Barbeau, our health commissioner. Thank you, Dr. Barbeau. Our social services commissioner, Steve Banks. The administrator of the Human Resources Administration, Grace Bonilla. The Small Business Services Commissioner, Greg Bishop. Commissioner for the Office of Immigrant Affairs, Bita Mustafi. And the Acting Director of the Public Engagement Unit, Eric Rotundi. And Eric, a special thank you to you and everyone. The outreach has been absolutely amazing, and it's changing lives. Thank you so much. Well, here's what we all know. We are the biggest city in the richest nation on earth. And yet there are 600,000 people who do not have health care coverage. 600,000. I want to remind everyone that is the size of the entire population of Milwaukee or Baltimore. That's a whole city worth of people who don't have health care. And they don't know where to turn. They live in fear of something going wrong. And we know one thing for sure, they do not get the health care they need when they need it. That's that emergency room trap again. If they get health care, it's when it's already too late. That leads to emergency room visits, and that leads to hospitalizations that could have been avoided in the first place. Everyone loses then. Certainly the patient loses when they didn't have primary care, when they didn't have specialists when they needed them, so they end up in the emergency room or they end up in the hospital when it could have been solved on the front end. That's bad by any measure. But I'll tell you something else, the taxpayer loses too. When all that money is spent, when it's too late, rather than a lot less being spent when it could make a bigger difference. We only can break through that problem by getting everyone covered. And I want to emphasize to everyone, this is a different mindset. I talked about this previously. You know, once we said to people that pre-K was for everyone, families knew they could depend on it, and they made their choices. They decided how they were going to approach things with that knowledge that it was universal. It helped people organize their lives, and it answered a lot of questions. You knew you weren't going to have to wonder. You knew you weren't going to get your child rejected from pre-K. A lot of parents, for years and years and years, tried to get their children to pre-K. There was no slot that worked for them. They got rejected. They had to come up with something else. They did something less good. Well, that's what 600,000 New Yorkers have been doing when it comes to health care. They couldn't find an insurance that worked for them, or they weren't eligible. So they did something less good, and they waited, and they got sick, and then they got sicker, and then they went to the emergency room. When every single New Yorker knows that health care is there for them, they will act differently. They will get help when they need help. They won't put it off. What Shaylin talked about is a great example. When you know it's there for you, you go to the doctor when you need it. And that will make us a healthier city. You know, every single person you stand next to in the subway, everyone you work with, you want them to be healthy for their sake and yours. Here's a way to actually achieve that goal, and it's in our reach. So I hasten to add, because I want it to be crystal clear, if you said to me, is the ideal to have Medicare for all at the federal level? Of course. That could happen tomorrow. That would be a game changer. Or single payer in Albany? Of course. I want to see those things happen. I believe we'll get to that day. But until that day comes, we have to take care of our own people. And we have to show cities and states around the country that it can be done right here on the ground. We have to push the spectrum. We have to show people that the notion of universal health care is living and alive and doable right here in the nation's biggest city. That's what we're going to do. Now, let's be really clear how we're going to proceed. Every single New Yorker who does not have coverage will get coverage under this plan. If you are like Shaylin and you are eligible, we are going to reach out to you. We're going to make it easier than ever to sign up. We're going to provide you with better care through Metro Plus than you've ever seen before. It is going to be 24/7 help available for you. When you have a problem, you will get to call a phone number, talk to a trained person who will tell you immediately where you can get the help you need right away. If you need primary care, you're going to have that option because you will be assigned a primary care doctor with a name, with an address, an actual human being who becomes your doctor all the time. When you need specialists, they'll be available. People haven't experienced this before, where there was a public option available that was high quality, that was in every part of the city, that was easy to use. This is going to be a game changer, and the more and more people we reach, the bigger difference it will make. So we got about 300,000 people who are eligible, but not signed up. Our goal in the next 6 months is to reach the first 30,000. There's going to be an intensive Get Covered effort, a brand new wave of Get Covered NYC. This extraordinary group of dedicated professionals is going to go out, but we're going to also have, working with them for the first time, all of the people who work for the city and every day talk to their fellow New Yorkers. Imagine whenever a parent goes to their school, they're going to have an opportunity to sign up for health insurance if they're eligible and they don't have it. Think about the reach of our school system, 1.1 million children, all the family members that we can reach through them, all the 400,000 New Yorkers who live in public housing. We communicate with them every single day, but we've never communicated with them on the fact that they could sign up for health insurance. Every city agency, every agency that works on behalf of the people of New York City will become a part of it. So all the good people at Get Covered NYC are going to have a lot of new allies and a lot of help. So our goal by July is to sign up the first 30,000 who are now eligible but uninsured. Overall, we want to reach 300,000 people, and that effort will speed up as the city agencies become a part of this initiative. Now, I want to remind people that while we're promoting this option and showing people what an impact it can make, there are the other options available on the insurance exchange, and there's a lot of great choices for people who need them as well. But you only have till January 31st of this year for those options on the exchange. So I'm going to ask all our colleagues in the media, please include in your coverage that January 31st is the deadline to sign up for health insurance via the exchange. That's just 9 days from now. And it's a wide range of options. For those who are eligible and want choice, the best bet is to sign up in the next 9 days. But after that, there's no question of our ability to keep signing up people for Metro Plus. That's year-round. That's something we control right here in New York City. And that enrollment effort is going to begin immediately, and it's never going to stop. It's going to grow and grow and grow. So those are the immediate things we're going to do. Also want to remind people the NYC Care Initiative is starting soon, and that's focused as well on the folks who are not eligible, but they need health care just as much. There are 300,000 New Yorkers who work beside us, live beside us, contribute to this city. They happen to be undocumented. They're our neighbors. They deserve health care too. If they're healthy, we're all healthy. That's what NYC Care will do. Because again, if they are healthy, we are all healthy. It's going to make a huge difference. So everyone, if you want to know how to sign up, again, you heard Shaylin say how easy it is. Right away, Get Covered NYC. You can find it online. You can call 311. You heard what she said, 2 seconds to connect, and then a very quick process to sign up, and then right away, you've got a doctor. You're in business. You're going to do better. We are now going to take the formal step of instructing and ordering all city agencies to involve themselves in the outreach effort. I expect every single city agency, every agency that serves New Yorkers, to do their maximum to ensure that people are signed up for health insurance. This is everybody's business. This is a matter of commitment for all agencies to be a part of this effort. And to make sure that happens, and that starts right away, I will sign an executive order instructing the agencies to act immediately. And here it is. There it is, everybody. You're all in business. We need you now. All city agencies will help us make sure every New Yorker has access to health care. Every single one. Are you ready for the mission? Yes. Are you ready for the mission? Yes. Okay. I believe you now. Okay. Whatever you do from this point on, if you go for a job training, a small business services, if you pay your taxes through the Department of Finance, if you pay a parking ticket, if you go and get assistance for your family, wherever you are, you will have the opportunity to sign up for health insurance. And I want to make clear that this is a very poignant moment to think about what we're doing here today. Because yesterday, we celebrated the holiday in honor of Martin Luther King, Jr. And I talked about yesterday the fact that he didn't just talk about civil rights. He talked about economic justice as well. And if you really look at his writings, his speeches, everything he was talking about, it went a lot deeper than sometimes you hear at the various commemorations. Here is a quote that says it all about what we're doing here today, because Dr. King understood that health care was a human right. He said, "Of all the forms of inequality, injustice in health care is the most shocking and inhuman." Those were the words of Dr. Martin Luther King, Jr. The most shocking and inhuman. And yet it's been tolerated for too long in this country. Here in New York City, we are heeding Dr. King's words, and we are going to make a difference right here in our city. A few quick words in Spanish. Estamos trabajando para que todos los neoyorquinos tengan cobertura, sin importar su estatus migratorio o capacidad de pago. Con la orden ejecutiva de hoy, todas las agencias de la ciudad deben informar a los neoyorquinos sobre las opciones de cobertura. La atención médica es un derecho humano. Llaman al 311 y piden que les conecten con Seguro NYC. Gracias. Someone's going to do it right away. I like that. All right, and now one of the masterminds of this great new plan. I want to thank her for her leadership, our Deputy Mayor, Dr. Herminia Palacio.
Good morning. Thank you so much, Mr. Mayor, for the introduction and for your incredible commitment to bringing health justice to New York City. Thank you, Shaylin, for sharing your story enthusiastically and for saying how important it is and how easy it is. Thank you, Kings County and all of Health and Hospitals, and Dr. Katz, my partner in crime. 2 weeks ago, you heard the mayor announce NYC Care to help New Yorkers without insurance access quality, affordable care. And as you've just heard today, we are not letting up. This is a march towards health justice. The executive order that he just signed, we're taking another step in this march. The executive order, as you've heard, will require all city agencies that interact with New Yorkers to provide them information about affordable health insurance. People will be connected with Get Covered. The order will impact all health and human services agencies, but other agencies that you don't think about necessarily for health, like the Small Businesses Services, Department of Finance, PUCs. You may encounter information about health insurance options when you walk into the Office of Workforce Development for job placement training. You may encounter it when you visit the Department of Finance business centers to pay property taxes, or you're simply attending parks programs for your diversion and your health. As a physician, more importantly, as a primary care doctor, nothing makes me happier. We have talked about the importance of primary care. Often people think about that in terms of the science of medicine. Let us not forget that a primary care doctor brings you the art of medicine. A primary care doctor brings you compassionate, holistic care. A primary care doctor engages with you in a dialogue, not just that one day, but sometimes over years, sometimes over a lifetime. A primary care doctor listens to you, gets to understand you, and I have to say, as somebody who practiced for a long time, a primary care doctor is happy to see you. It's happy to see you, like as a human being. So getting a primary care doctor is about making sure that you get things like preventative care. It is about being able to go somebody when you have a sore throat or a cold. But it's also knowing that when you go with a concern, sometimes the most intimate of concerns that you have a trusted ear who's listening to you, a trusted hand you can hold as you're facing sometimes very scary things. So, effective immediately with this executive order, the Public Engagement Unit, which oversees Get Covered NYC, will work in coordination with my office and city agencies to implement this new requirement. They'll be ensuring that agencies have all the resources they need to communicate with people who need insurance. They will be training frontline staff. The executive order will increase our outreach efforts, reminding people that the city's public health option, Metro Plus, is here for them. No greater testimony than Shaylin's testimony today. We will be doubling down on the existing efforts referring the uninsured to enrollment insurance, but our goal is to find new opportunities, new ways to spread the word, new ways to reach out, new ways to find you where you are and get you the care that you need. We want to be all doors and all windows into Metro Plus and healthcare insurance. New Yorkers have the right to health care, and they have options. We urge New Yorkers without health insurance to get in touch with Get Covered NYC before January 1st for the state's open enrollment period. But this work is not going to end for us in 9 days, as you heard the mayor said. We will be enrolling ongoing. Seniors, low-income New Yorkers can enroll year-round. Anybody who has an event such as getting married or changing jobs or having a child or adopting a child, those are all events that qualify you to enroll even after the open enrollment period. We know that navigating some of these health insurance options can be daunting, it can be confusing, but that's why we're here with Get Covered NYC, people who can help you connect. Because as you heard, we believe that healthcare is a human right. So if someone in your life needs health insurance, call 311 or visit nyc.gov/getcoverednyc. And now I will say a few words in Spanish as well.
Show off.
El acceso a servicios de salud es un derecho, no es un privilegio. La ciudad está haciendo todo lo necesario para asegurar que los neoyorquinos sepan que hay opciones de seguro de salud gratis o de muy bajo costo. De ahora en adelante, todas las agencias de la ciudad ofrecerán información sobre cómo obtener seguro médico. La fecha límite para inscribirse es el 31 de enero. Quedan 9 días más. Si no tiene seguro médico, llama hoy mismo al 311 o visite la página web nyc.gov/getcovered. Pero aún después del día 31 de enero, nosotros estamos aquí para ayudarle, especialmente hay opciones de Metro Plus de bajo costo para muchas personas que no tienen mucho sueldo. Así que le agradezco mucho su atención y le deseo un año 2019 con mucha salud. A healthy, happy 2009 for everyone.
Amen.
19.
They had 2009 already. Let's give them 2019. So there are elected officials who bring extraordinary experience to their work, and Councilmember Matthew Eugene not only represents this community and this wonderful facility, but he has been a healthcare professional throughout his life, and he has made it his life's mission to help people who are underserved and a lot of folks who didn't have the help and the access they needed. So I know he brings a special perspective to this. Councilmember Matthew Eugene. Thank you.
Thank you very much, Mr. Mayor. It is, as you know, my name is Matthew Eugene, the New York City Council member representing District 40. That means the district where you are at right now. You feel, I think you understand how privileged, how happy I am to join the mayor for this very, very important rally. And I'm grateful to the mayor for everything that he has been doing, he's doing for the hardworking people in New York City. And I'm also grateful to the mayor for a very special reason, for choosing this very place, Kings County Hospital, a great institution where people, dedicated doctors, nurses, medical professionals, are working hard every single day to keep our New Yorkers healthy. And I want to take the opportunity also to commend and to thank the leadership, the CEO of King County Hospital. Thank you very much. Thank you. You know, as the chair of the Civil and Human Rights, I love when the mayor said health is a human right issue. It is. It is a human right issue. It is not a privilege. And I think also this is the responsibility of the government to do everything possible for the people to get access to the highest quality of health. This is exactly what the mayor is doing today, assuming the responsibility of the government reach that goal and fulfill this responsibility of the government to offer medical care and medical coverage to everybody. Let's put our hands together for him, please. One of the things that I want to say, it is important for the government to provide access to medical care to the people, but it is a benefit, it's a win-win situation, because the people who are going to get access to medical care, they are the people who work very hard to make New York City such a great city. We need them. And they work hard also to sustain their families. If they are sick, this is going to be a big burden for the government and for my friend and my brother, the mayor, because we will have to maintain their families and to spend more money than if they had the medical coverage. One of the things that I want to mention also, we public servants who are members or are serving in different city agencies, we know that in the city of New York, there are very great and important programs, useful programs. But the problem is, not everybody takes advantage of that, even when they are qualified. You know why? Some of the time, they don't know. Some of the time, they are busy. Some of the time, they don't see the importance of those great programs. But I'm so happy that the mayor came with an innovative concept, a new concept to register people to medical health insurance. He's going to them. The mayor said that we are not going to let them come, we are going to them. We are going to involve everybody to ensure that the people know when they have to register, what they have to do, and the importance of getting medical coverage. This is something remarkable that is happening right now. And let me tell you, myself also, as a strong advocate for health, I pledge to continue to work together with the mayor to make sure that everybody in my district registered for medical coverage, New York City Health. And let me conclude by saying that some people may say, why cover? Why should we cover those people who are not legal, who don't have immigration status? It is important. If we don't do it, we are going to have problems too. And the mayor said it eloquently. If they are healthy, we are healthy. My brothers and sisters, Mr. Mayor, thank you for giving me the opportunity to say some few words, because I keep saying every single day, and the people at Kings County can say, health is the most precious gift that we receive from God. Amen. And we got to do everything to preserve it. And I want to conclude by thanking the mayor for doing everything possible to preserve this beautiful and precious gift that we receive from God. Thank you very much, and God bless you.
Thank you, Dr. Eugene. The fact is that elected officials are going to play a very important role in this. And I want to thank you for amplifying that, because a lot of people go to elected official offices. It's one of the places where they can get this kind of information. And I know a lot of the current generation of council members and legislators are very activist in their approach and do a lot of outreach efforts, and they're going to be a big part of this. So thank you very, very much. I want to hear from one more very important voice, because we are proud to be reaching 300,000 New Yorkers who happen to be undocumented. And one of the strongest voices of support for this initiative has come from the New York Immigration Coalition. I want to introduce the Chief of Staff for the New York Immigration Coalition, Gigi Gazan.
Well, so we know at a time that when immigrants and healthcare are under attack by the federal government, Mayor de Blasio is stepping up to the plate once again by signing this executive order expanding the work of Get Covered NYC. and expanding the work that they're already doing to help New Yorkers enroll in insurance. And when we say that when immigrants are under attack and we stand up and we fight back, it's not just the fight in the streets and marching in the Supreme Court. It's the inclusive fight. It's the protective fight. It's the inoculation of our communities, because immigrants are part of the fabric of this community. And we look forward to our continued work with the mayor on landmark initiatives such as this, and as was mentioned, New York City Care, which will begin guaranteeing health care to every New York City resident, regardless of status or ability to pay. These initiatives have the potential to make all New Yorkers, all of us, healthier, stronger, more vibrant. And we'd like to thank the mayor, Dr. Mitch Katz, New York City Health and Hospitals, whose work to ensure access to quality health care is so important and essential to the well-being of all New Yorkers. Y en español les voy a decir que como hija de inmigrantes que teníamos miedo de ir al doctor, esto es un paso muy importante para protegernos a todos, para incluirnos a todos, para protegernos como comunidad y como familia y como neoyorquinos. Sí se puede, y en solidaridad, thank you to the mayor and thank you all.
Well done. Strong in both languages. Thank you. Okay, so we're going to first take questions from the media on this announcement today, and then we're going to take a quick break so all these good folks can get back to other important things. But first, let's take media questions on this. Gloria.
January 31st deadline, what does that really mean? What happens after January 31st, and is anything going to change?
Yeah, January 3rd, I'll start as the layman, and then Armenia can jump in with more expertise. In terms of what the exchange does, look, I'm a big believer in the Affordable Care Act. I'd like to see us go a lot farther than the Affordable Care Act, but one of the very good things that it has done is given people choice that they didn't have before, and the exchange is the vehicle through which you get to choose among available health insurance plans. That window goes till January 31st. So if someone is uninsured and they want the most consumer choice, get online, look at what's available. If you find one that works for you, go take it. After that, though, we're quite clear about the fact that we keep going, because there's a huge number of people who qualify for Metro Plus, and we're going to keep going year-round to get them signed up. So I would say the simple way to interpret to people is you have the most choices up until January 31st, until the next enrollment period, which I think is November, you said? But if so, you want to maximize those choices, jump now. You have 9 whole days. But after that, we're going to be here, and we're going to keep signing up a huge number of people.
So you're just referring to the regular health care?
Correct. Correct. But I think part of the issue, and you've probably watched this, is clearly the Trump administration has tried to discourage people from signing up. They've taken away a lot of the promotional efforts. They've suggested that Obamacare wouldn't be there in the future. There was obviously a court decision, but that's been stayed. We want to make it loud and clear to all New Yorkers that the Affordable Care Act is alive and well, and you can sign up until January 31st on the exchange. But then we're going to keep going after that with the tools we have. Any questions on this? Yes, please.
I'm just curious, since why needed to sign an executive order? This is just sort of an initiative to other agencies to publicize the city.
No, it's much more than publicize. I appreciate the question. They have to be active participants in signing people up. This will now be an obligation to use time and energy to make sure people are signed up for health insurance who qualify and don't have it. And when we have done that, we did that obviously with pre-K and 3K. It had a huge impact. These good folks from Get Covered have done amazing things, and this is again the difference. Before the Get Covered initiative, a huge number of people who were eligible and could have gotten insurance were not getting it. This team and all of their partners around the city have signed up 130,000 people in the last 2 years because there was a targeted outreach effort. Let's do that again. 130,000 New Yorkers got signed up. Let's give them a round of applause. Thank you. And that was because there was a targeted effort, but that was not every city agency treating this as a priority and putting real time and energy and focus into it. So now it is a formal instruction and direction to all agencies that this is now part of their mission too. Please.
Will there be data that shows the Department of Sanitation who signed up? Are they required to signed up NYPD, we sign up 50 people. This is, I mean, and how would it look for like an agency like PSNY, NYCD?
Sure. One, this initiates the action today with the executive order. I agree 100%. Every agency will determine goals according to how much they interrelate with people and what their circumstances are. Obviously, an agency dealing with security has other issues that will come into play. But let's take obvious ones like Department of Education, where there's a huge amount of connection with families, and that opportunity is not being tapped right now. I think there's a lot of other ones like that, as you heard previously. So we will figure out what each agency, what they can do, and then we'll work with them to have real goals, and I'm very comfortable with saying we'll publish what each of them did on a regular basis because we want it to work. The initial goal is to add 30,000 more, so 1/10 of our overall goal by July. But again, the agencies will just be ramping up during that period. A lot of that will be get covered, obviously. But as the agencies get more and more engaged, that number can continue to grow. So, yes?
Is there anybody from Metro Plus here?
Is there anybody from Metro Plus here? I guess there are people from Metro Plus here.
Who runs it, and could they tell us how many people are currently signed up? And when you say you're going to sign up 30,000 people in 6 months, does that mean 30,000 policy holders? Or for instance, I have health insurance, I have 3 kids who are my
Right.
There's 4 of us. So am I one under your goal, or are we 4?
Let me just answer that one last question before you. If you signed up today, you would be covered, your children would be covered, and your new beard would be covered. He went right by that.
So there are currently about 520,000 people enrolled in Metro Plus. The 30,000 goal is really get covered enrolls through the exchange and Metro Plus. That's sort of the overall universe. Really, our goal is to make sure New Yorkers have an insurance plan. We want to make sure that people know that Metro Plus is a public option. I want to go back to something that the mayor said. After January 31st, we will continue to enroll in the Metro Plus Essential Plan. It's important that people understand that the premiums are on average about $20 a month and can go down to 0. So it's really important for people to understand this is a very affordable plan. The Essential Plan and Metro Plus you can enroll throughout the year, but as the mayor said, if you want on the exchange, the New York State Exchange, which has lots of the private insurers as well, that that enrollment needs to be completed by January 31st.
Other questions? Last call, media questions, yes?
I guess just to go back to the executive order, I'm still pretty confused about why it's necessary since you are already kind of, in charge of all these city agencies, and why does it have to be in the form of an executive?
When you do an executive order, it ensures that the instruction is followed up on. It's as simple as that. These are agencies with a lot to do. I think everyone here would testify to that fact. They've got plenty of important work to do. We're saying this is now a priority mission for all city agencies, that we need everyone covered, that it will have huge positive impacts for this city, and it's part of their work plan now. So the executive order makes very clear this is not an option. This is now a priority for all agencies. Yes?
And again, this might be too in the weeds for something that you just signed, but what will count as signing someone up? Will it be a teacher saying, oh, hey, your mom should sign up, and then actually going through the motions with a parent in school? Would that count towards it?
A sign-up is a sign-up. It has to result in people getting insurance.
So it's not just referring. And if that's counted, if that's being given to the different agencies, then what is the Get Covered team doing?
They've got plenty to do because there's plenty of New Yorkers who don't interact with a government agency in a way that would be conducive to being educated on health insurance or signing up for health insurance. What they've been doing brilliantly is they go everywhere. They go to community events. They go any place where people are. Famously, one of the things that happened with Get Covered and with Pre-K and 3K initiative is going to barbershops and beauty salons, community events, local street fairs, block associations, you name it, wherever people are. And it's proven to be extraordinarily effective. Getting people in their community when they have time to actually think about something is a big piece of the puzzle. But we also know that the agencies really reach a lot of people, and different people a lot of times, and we need literally to grab every opportunity to get people signed up. But we're only going to count towards this number if someone actually has coverage. See if there's anything else on this. Go ahead, Rich.
Do you sign people up at bus stops? Because that's one of the few places where New Yorkers can't run away from.
I like that. You're a visionary. I know. I think that's right. I'll do a survey of team bus stops. I would also say subway platforms where you have a captive audience. Bus stops, subway platforms, do you do that?
Subway platforms.
Subway platforms for sure. We're going to start doing bus stops now. Yes, we are doing bus stops. Last call. Okay, let's give these folks a chance to go on to their good works. Thank you, everybody.
And we have been listening to New York City Mayor Bill de Blasio and other city officials speaking at Kings County Hospital in East Flatbush, Brooklyn, about affordable health care for New Yorkers. The mayor at the podium this morning signing an executive order now requiring city agencies to provide New Yorkers with information about affordable health care options. The mayor calling this a game changer for the city. He says there are about 600,000 people here in New York City without health care. And the goal, he says, is to make the process of accessing the uninsured easier. In the next 6 months, he says he wants city agencies to reach 30,000 of those people who are eligible for city programs. Now, that includes reaching out through the school systems, through NYCHA, the New York City Housing Authority, as well as all other city agencies. The mayor also says those agencies will now be obligated to provide this information to eligible New Yorkers. Of course, this is a story we will continue to follow for you here on CBSN New York. We're going to take a short break. We'll be right back.